Hello, my name is Christine Zarowski and I'm the sexual health clinician from the Prostate Cancer Supportive Care Program. And today I'm excited that I'm able to speak to you about orgasms after prostate cancer treatment. Before I move on to orgasms, I just want to take a moment just to acknowledge the donors and supporters of our program. The funding for this program was initially granted by the Specialist Service Committee back in January 2013. And in March of 2017, the BC Ministry of Health actually provided additional funding so we can expand our program province-wide. I also want to acknowledge all the private donations that we received from groups and patients or other individuals, because without those donations, without the funding, we would not have the Prostate Cancer Supportive Care Program, and we would not be able to be here to help support you. So orgasms. So what is an orgasm? So basically, orgasm is generally regarded as a height of sexual excitement. It's a powerful feeling of physical pleasure and sensation which includes a discharge of accumulated erotic tension. You can experience orgasms with your mind and your body, with increased heart rate, blood flow, muscle tension, breathing, leading up to the physical release known as ejaculation, and then the mental release of sexual energy recognized as orgasm. A lot of times individuals think that orgasm and ejaculation are one and the same, and they're actually two different types of events that happen. Orgasm includes the pelvic contractions and the intense pleasure and release that you feel, and ejaculation is that expulsion of semen from the penis. Men can still be orgasmic without even having erections, and the other thing that's really important to keep in mind is that orgasm is not required for the experience of sexual pleasure. So, can you have orgasm after prostate cancer treatment? The answer is yes. A lot of men will say the orgasm is staying much the same, but also there's men that say that the orgasm might be different. In any case, orgasm can still be pleasurable. So how does prostate cancer treatment affect orgasm? Well, first off, active surveillance is not really a treatment, it's more of a monitoring of a man who has prostate cancer. But so if a man is feeling quite anxious about having prostate cancer, that can affect the sexual response cycle. And that means it might be harder to actually achieve that orgasmic threshold. With prostatectomy, there's actually the surgical removal of the prostate gland and the seminal vesicles. Both of these body parts are essential for producing the fluid for the ejaculation. So when the prostate gland is gone, along with those other glands, there's not going to be ejaculation. And sometimes you hear the term dry orgasm. The other thing that can happen after prostatectomy is something known as climacturia. What climacturia is a release of urine at the time of orgasm. When we think about radiation, radiation can be either external beam radiation or brachytherapy. Sometimes what we find with brachytherapy and the initial stages after treatment has been performed, that there can be some blood noted in the ejaculatory fluid. Usually with both radiation, external beam radiation, and brachytherapy, over time, the amount of ejaculate will begin to decrease. With androgen deprivation therapy, what we find is that this therapy actually suppresses testosterone. And testosterone is very important for the sexual response cycle. So again, having no testosterone, it makes it challenging to reach orgasm. With a lot of these prostate cancer treatments is that a man can experience some discomfort or pain. Usually this is short-lived and usually resolves on its own. So what are some of the steps to improve or recover orgasms? Well, a big one, an important one, is actually stay present. It's easy to become distracted and worrying about how your body is or isn't going to perform or do, right, what it's going to do. So I use the analogy of a playing field. When you begin to think about what's going to happen, you're no longer on the playing field, you're actually going up high up in the bleachers. So you're disconnected with yourself, if you have a partner, with your partner, and with the sexual situation. So what you need to do is you need to get back down off those bleachers, get back on that playing field, and stay present with that sexual situation. The other thing to look at is actually review the type of medications that you're taking. So certain medications, such as antidepressants, can actually alter the sexual response cycle, including the ability to have orgasm. If you're taking medications that are not sex positive or hindering your ability to go through that sexual response cycle, including having an orgasm, talk to your doctor, because there's different types of alternatives that can help maintain your health, but also your ability to be orgasmic. Hormones are another thing. As I mentioned about testosterone, in certain situations, a man might have low testosterone. Not necessarily a man who's on ADT, but naturally occurring low testosterone. If that's the case, you can have that reviewed, and potentially you might be eligible to have testosterone supplementation. Again, that could help with the orgasmic response. Another hormone that's involved with orgasm or arousal is oxytocin. And oxytocin is actually produced in both men and women. And so, sometimes, a man might actually use oxytocin as a supplement to, again, enhance orgasm. So using manual or oral stimulation, and remember that orgasms can occur without erections. So what we see with this is that, if you are in a partnered situation, talk to your partner about how you want to have that stimulation and what feels good for you. Sometimes having that conversation in the beginning might be a little bit awkward or a little bit embarrassing, but over time it will definitely get better. And the other thing to remember is that communication is essential for creating sensuous and sexually appealing interactions. Focus on your breathing patterns, right? Sometimes, when you experiment with the depth and frequency of breath, then that actually can change how you can experience orgasm. Sometimes hastened breath can bring about orgasm sooner, whereas a slow, deep type of breath can prolong the time to orgasm. The slow, deep breathing also can help to prolong the orgasm itself. Again, performing Kegel exercises to help strengthen the pelvic floor is very helpful, because the stronger the pelvic floor is, the better orgasmic response you're going to experience. The other thing about Kegel exercises, they can be helpful for managing climacturia, which again is that release of urine at the time of orgasm, and also help with urinary leakage when you become aroused or sexually excited. If there is urine leakage that is occurring during sexual play, there's a couple things that you can do. First of all, you can empty your bladder before you begin sexual play, or what you could do is you could protect that sexual area with maybe a towel or a blanket. Or you can be sexual in an environment where it's okay to have urine flow, such as a bath or a shower. The other thing that men might try is by putting a little tension band at the base of the penis to kind of compress the urethra so urine doesn't come forward. So a couple things to keep in mind with that. First of all, unless you like pain, you got to give yourself a little bit of a trim down there, right? So give yourself a haircut, cut back those pubic hairs. The other thing is using some lubricant. By using the lubricant, it makes it easier to get that tension band on and off. And another thing to remember is that do not leave that tension band on for more than 30 minutes. So you don't roll over and fall asleep, because you will not be happy in the morning. Yeah. So the other thing is a lot of individuals might be concerned about what happens if urine gets on my partner or in my partner. Well, generally speaking, urine is actually considered to be sterile. So usually there's not a risk to the partner if urine happens to get on them or in them. The other thing about Kegel exercises is that it can be helpful for managing orgasmic pain. If you do have orgasmic pain, it is important to talk to your doctor and also your PCSC team members, specifically your sexual health nurse or the pelvic floor physiotherapist. Another thing to remember is use good sexual lubricant, right? A lot of lubricants that you can find them in certain pharmacies. A lot of pharmacies have sexual health areas, or you can get lubricant at adult love shops. So what happens is when the penis is not fully erect or as a semi-erection, the tissue is more at risk for injury, leading to pain, and pain which is not normally conducive to sexual pleasure. So having that pain leads to distraction and therefore challenges with reaching orgasm. Right? Lubricant can protect the penile tissue and add actual sexual pleasure, bringing you closer to that orgasmic threshold. The other thing to think about is the characteristic of the stimulation. For some men, they like continuous stimulation. They find this most effective in building up that sexual tension, right? Other men find starting and stopping actually can increase that orgasmic experience. And so again, it's good to kind of experiment what works well for you, right? Introduce different types of stimulation. Vibration, for instance, may help to intensely stimulate the nerves responsible for orgasm, and they also might stimulate the nerves responsible for erections, those cavernous nerves. Other thing that you can focus on is changing the style of lovemaking. Introduce more psychologically versus genitally based arousal techniques into your sexual profile. Some examples of this is things like tantric sex or even mindfulness. So remember, the prostate cancer experience creates an opportunity to learn new ways of being sexual, including new experiences with orgasms. And again, our members at the PCSC program are here to help you as you work towards and learn how to optimize your orgasms. Thank you.